So good morning, everyone. It's 6:30. So we will start with our new session, next session. This session will be taken by Dr. Jayita. We all know Jayita very well. Jayita is a professor in Department of Palliative Medicine at TMH Mumbai, and very renowned and popular teacher amongst MD students. She is also board of director, International Psycho-Oncology Society. She is on editorial board of Psycho-Oncology Journal and Indian Journal of Palliative Care. She is also Central Council member of West Zone of Indian Association of Palliative Care, and she has got wonderful publications, several wonderful publications. So I have heard Jayita many times, and last time when I heard this lecture, I was so impressed, Jayita. And I can tell you that on Teachers' Day, I want to wish Jayita as well as all the renowned teachers, those who are here, even the students, those who are teaching us something new. They all are teachers. So everybody, happy Teachers' Day. And we will start, and I'm sure that at the end of the session, you will learn a lot. As Dr. Jayita has already said that you should have a pen and paper in your hand. So please keep pen and paper, and Dr. Jayita, please start your lecture. Thank you very much for joining us.
Thank you so much, Sushma ma'am. You're always very kind in introducing me. So happy Teachers' Day to everybody. And on that note, let us see what we can learn together on this particular topic, and that is developing a research question. Can you see my slides?
Yes, ma'am, we can.
Great. So to just have this clear at the beginning, as Sushma madam said, I gave this talk in an earlier training program for the CTC on the research methodology training series. So I have actually taken my presentation from there, and that is why you can see the date as 26th of May. What we are going to do today is how to basically develop a research question and how to write a research question. And how we are going to do it is because you had a very detailed talk by Dr. Hari, an excellent talk on which he has already laid the foundation for the problem statement and what are the different components and how to do it. So I think you have those basics already in your so I thought we just take we have about 45 minutes, so I thought we will just take 15 minutes for going through some bits again for revision, and the next half an hour let's work through some examples by ourselves. So just to let everybody know that we are all here to learn. There is no right and wrong. We are here to practice, and I also get things wrong sometimes, and we all learn from each other. So please do not hesitate, and please feel free to write down and share, because as I said, this is a learning session. So we, from the last talk and just for a revision, why do we need a research question? It's for these reasons. It is for understanding a problem and studying it, because we are doing our clinical practice and there are so many things which we come across, and some things we need a deeper understanding of and we need to study. The research question also guides the methodology of what we are going to use, what type of study design we are going to use. It brings focus, and most importantly, it makes the purpose clear. So in these things, to develop that question, we have 4 steps. One is think of a topic. Second is think of the research question, just thinking at this stage, and how to state it. So there are some thoughts we have to do for this. Do we need a hypothesis? It depends on what is the topic, what is our question, and that is what it will guide the methodology, and then the actual act of writing down the research question. And the first three parts, as I said, has already been touched on and explained also in detail. Some of these parts, especially of the problem statement and how to state it and what are the components. So today we'll take this time, an opportunity to just work through some of these components. So let us then think of the topic. So all of you have your pen and paper ready. So take 2 minutes and please write down the topic of the topic. Anything that you want to develop that research question of, please write down the topic. You have about a minute. Okay, so then where would you, if it's okay, if you want to put it on the chat, or if it is okay for Archana to unmute and answer. When you have to write down this, whatever that you want to do the research question, how do you really decide on the topic? Where does it come from? Anybody?
You can unmute if you'd like to share.
You can unmute. You can put on the chat. I'm monitoring the chat. Where will this topic come from?
Hello.
Yeah, should be yes.
I think the main area that we'd get our experience from would be the OPD. So
you're talking about your clinic experience or experience from anywhere in your work. That's great. Thank you, Shruti. Anybody else? Isha, you said topics come from your interest and how feasible. And Jennifer says that it is for the need around us. Yes, very good. So let's see where you will get. And this week, I think we did it last time, is something that you are observing in the clinic or in home care or in inpatient setting. Something that you heard or read or one of your seniors or juniors or colleagues discussing, or somebody else discussing, like the oncologist, and some personal experiences that you have gone through with a patient and you need to understand it better and want to know more about stakeholder needs. Stakeholder needs meaning whoever that is involved in palliative care. And who are these? These are us, these are providers, these are patients, these are patient advocates, these are administrators, there are other professionals depending on which discipline you're doing palliative care in. So once you do this, so have you, anybody wants to share about the topic? Dr. Akash? See, we are here in it to learn together. So please, can you tell us challenges where we see in clinical practice? That is Dr. Shankar. Anyone has thought about a topic? Mirtazapine in improving appetite. Okay, let me write that down. Dr. Meenakshi, you will put that, you will keep that in mind. So I'll come back to this. Mirtazapine in improving appetite. Okay. Anybody else? Anyone else? I was thinking of this topic more applicable, most applicable to the first year MD DNB students. So please, why don't you just participate? We are all here to learn. See, some of us are already doing some research and we know, but the first years, why don't we start some practicing today? Anyone? The first years, Dr. Akash, Dr. Divya, Dr. Vishnu, Dr. Khushbu. If you don't want to talk, you can put it on the chat. Very good. Psychological distress in head neck cancer patients. Thank you, Isha. So, psychological distress. So we have one more. Somebody not from Tata Hospital. First years, we are all here to learn together. So let us get on with it. Then speak, I will write. Okay, so I have got more, not first years, but still, use of opioids in cancer pain management. I'm just going to write it in short. There is more, and there is effectiveness of care offered by care. I'm not writing the full thing, offered by secondary palliative care units of Kerala. Okay, very good. So, so you have done my burden of caregivers. Thank you, Dr. Sangeeta. So you've done my work very easy. So you have about topics, which is one is mirtazapine, which is pharmacological, which is one is psychological distress, head neck cancer patients. You have also opioids in cancer pain and effectiveness of care in this. So to all of you is my question, cannabis use in lung function. Fair enough. All you've got your topics very well. So my question to you is, those who have got a topic, and thank you for sharing and thank you for doing it, what is the subtopic that you are focusing on? And I think some of you have already done that. You've done that about subtopics. You already have got it. But what else would you be focusing on? The one that we have use of burden of caregivers and say the cannabis use in lung cancer. So would you like to think of a subtopic? The time you think of a subtopic for those things. So one, when you discuss about a topic, so is this topic of interest to me? So because we have to do the work, so it better be of some interest to me. Otherwise, I'll be doing some work which is going to be lot of chore and lot of tedious work. Also, is this a topic of significance? And all of you that you said about metrazapine, about psychological distress, about use of opioids, cancer, cannabis, and burden of caregivers, obviously, there is a topic of significance. Will research into this topic be useful? Yes, obviously you think that, and that is why you are going to work on that. And does this research into this topic meet requirements of my degree program or course, whatever it is that we are doing? It could be an MD, it could be DNB, it will be a certificate course, it will be a dissertation that we have to do. So these are the things that we need to keep in mind when we discuss the topic, and then you already have that. So I've kept this over. So like this is the main thread of it. So I'm going to use a more open topic that you gave me, and that was burden of caregivers. And from here, let us go as what do we do next? Some of you already had that subtopic, so that is not going to be that difficult in that. So we are going to do this, and I'll come back to it later about the burden of caregivers. So I'll go to the subtopic later, but how do I think about and state my research question? So it is the interest not just in the main topic, but what is that part of the topic, which is the subtopic, and what can I add to this topic? How will I get that? What can I add? It is, we have to read about what is already there. And the whole thing that makes it very nice to do is something that we find interesting vis-a-vis something that we find boring. So when we want to do research, it is something that tweaks our interest. And hence, if we read up, we find out whether things are already there. But if things are already there, is there some part of the thing that can be missing, or is something that I need to focus on? If it's already there, then maybe I may just, digress to another topic or do another way. So this is very important to me. One of the most important things is something that is of interest to me to start with in the first thing, because this is what is going to occupy a lot of our time and energy, and we need to sustain our interest and enthusiasm. So I always think about this as to that the topic and the subtopic has to be of interest to you. So now we go back to that subtopic. To the person who said about burden of caregivers, can you tell me about some of the subtopics that you're thinking about? I think Sangeeta Singh, you said about burden of caregivers. Would you like to tell us about some subtopic that you want to think about it? And the rest of you, the ones who already have not shared, can work on a subtopic on yourself, because I want you to take that piece of paper and what you have written. I want you to take that piece of paper, and that is the sort of template on which you can work your ideas on for later. So let that 145 minutes not go to waste, and something that you can carry forward and do this. So you physical and economic. So physical burden, economic burden. Very nice. Okay. This I'm just doing it as an illustration point. So we have a burden of caregivers. We want to look at physical and economic, and there may be other things. It could be spousal caregivers, it could be parental caregivers, it will be caregivers of children, parents of children with cancer. it could be it could be any group of population. So it's important when we are doing a research question to think of the subtopic as well. Go back to that. Okay. So then when I do that, what is it that I want to look at? I've got a topic, I've got a subtopic, but do I have a hypothesis? And what is a hypothesis? A hypothesis is sort of a logical conjecture about relationship between different variables. So suppose if I look at that topic, and it's a tentative concept. So it's a tentative concept. So now if I go back to one of the topics that you said, it was about psychological distress in head neck cancer patients. So what would be my variable? One of my variable, what is the main thing that I want to check is psychological distress and in head neck cancer patients. So maybe I think that psychological distress will be higher in head neck cancer patients. It could be higher as a whole. It could be higher as compared to some other cancer patients. It could be higher as compared to some other group of patients, or it could be higher just as a matter of the cutoff as to how many people are meeting the requirement for depression criteria or anxiety criteria. So it is a tentative concept, and then it sort of the variables need to answer one of these questions. What is it that I'm looking for? Who am I looking for? Where am I doing this? Where is the variable? When am I looking? What time point is I'm looking for? How and why? And some of the how and why questions may be a little difficult to do it in a quantitative study, and hence there are other designs that come up. So hypothesis is an important part, which is a logical conjecture, a best guess estimate between what do you think the relationships would be. So in another example that you said about burden of caregivers, you would think that one of the hypotheses can be that physical burden will be higher, or physical burden will be higher than economic burden, or economic burden will be higher than physical burden in the burden of caregivers. Or there are so many domains of caregiver burden, physical and economic are one of few of them. What are the other ones? So then what? It is who, where, when, how, and why. And what does a hypothesis help us to do? It helps us to investigate and verify. When I say burden of caregivers, it's a broad concept. When I say psychological distress, it's a broad concept. I need to cut it down from general to very specific, and I want to measure some relationship between variables. I have a sort of idea because that's what I think, and I need to check it out from other literature that I have, or what I see in my patients, because remember, it all starts from there. What we see in clinical experience, what we read, what we want to understand. And then what will my research question do? I want to look at some probable outcomes and results, which is what I'm investigating. So my physical burden in caregivers is very high, but it is less than the economic burden. Psychological distress in head neck cancer patients, anxiety is very high, but depression is less. Mirtazapine in improving appetite. Mirtazapine will improve appetite. So we are looking at effectiveness of mirtazapine in improving appetite. It will improve appetite. It will significantly improve appetite in the dose of so and so. So I'm looking at probable outcomes and results. My topic is improving appetite, or my topic is mirtazapine. Actually, my topic is mirtazapine, and what do I want to do as subtopic is whether it helps in improving appetite. So my hypothesis is Does mirtazapine help in improving appetite? So I think that mirtazapine will help in improving appetite. That is my hypothesis. It's a tentative concept based on what I have seen, what I have read. Now I want to investigate and verify, and my probable outcome results I want to show is that mirtazapine will help in improving appetite. How to develop that concept and how to write the research protocol, that will come in at a different class in the next class. So is it okay? So we are a very silent crowd at 6:55 a.m. So I will go on. So now what the thing is that if we can have a hypothesis, do we know when we can have a hypothesis? So one is, do I need it? Do I have it? What if I don't? When can I have a hypothesis, you think? When can we have a hypothesis? Right, okay, I will go on because we need to walk through lots more. So if the research question is clear, we can have a hypothesis. So I want to know if mirtazapine will improve appetite, right? So I want to measure these variables, mirtazapine and appetite, and hence I have a research question which is clear. I have variables which I can explore, and I can guess about how the variables might interact with each other, and there is a way that I am able to test, right? And yes, Isha, you're right. You said when we have a measurable outcome, that I already have some idea about what the relationship might be, and that is what we have. So in all the examples that we've given, so I don't know about psychological distress yet, whether I'm measuring it, it's going to be higher or lower, but my literature and my clinical experience says that yes, it is higher in head neck cancer patients, and hence those are the variables to explore, and I already have a guess about how the variables might interact with each other, and there must be a way that I'm able to test. So when do you think, in the background of this, when do you think we will not be able to have a research question, or we not be able to have in a research question, we will not be able to have a hypothesis? When will we not have a hypothesis? May not have a hypothesis. A non-experimental study, yes. How I will go on that. Any other guesses? Yes. So you said a qualitative study, because it is difficult to have a hypothesis as we do not have distinct. So when we are managing, see, a hypothesis, we already know something about what might the relationship be. When we are trying to understand a phenomenon in depth, when we are trying to explore something, when we don't have enough scientific evidence, or we don't know enough, that is when it is not possible for us to have a hypothesis. So I want to know, is spirituality and religiosity the same in our population? Is end of life care practices, what do patients or caregivers think about our end of life care practices? What if I have it in some group, but I don't have it in other group, and I don't really know why? Why have people said that their place of death, preferred place of death is home? So questions which are sort of more in depth, more understanding the why, which would be a qualitative study design, and that is when we may not have a hypothesis. And also in qualitative, we have to sort of, it's a inductive approach, so we need to reiterative approach, we may have to modify as and when we go on. And that's the difference with quantitative. So in qualitatives, we may not be able to have this. So we will not spend time on this part because we've already have a topic, we have a subtopic, and I've given you the sort of hypothesis in some of the examples that you have already given me. And we have done all this. So the ones who we have not gone through, would you like to take 1 minute and think about this, that this is a time, we have 15 minutes, we will be working through some of the examples. So this is the time to please write down your topic of interest, your subtopic, what do you think are the variables, and if not, then what will you do? We have about a minute to do this. And please, another request to the first years, MD and BNB, to please work on this. Thank you. 1 minute. So now we come to the important topic of how to write the research question. So you have the things ready, you have all the ingredients ready, and you're going to make this fantastic dish that you want to serve out. So you have all the components, and now you need to write this down. So what do we need to write the question? You have the topic, we have the subtopic, you have some variables, you want to measure some variables. I'm taking it that this we are doing a quantitative and not a qualitative to make our life a little easier. And we want to now actually write the question, and this is our main focus for the day. So these are the things that we need to look at. Topic, we've gone through that. Apart from that is, what is the context? Now, just Dr. Meenakshi, when you said about mirtazapine in improving appetite, what context were you thinking about?
I was thinking about doing it in a population of cancer patients, and I was thinking at what the dose is, and possibly when do you see onset of action of mirtazapine in improving appetite. I mean, it might cause sleep earlier, but when do you actually see appetite going up, or when does the patient say, yes, I'm feeling better? So these were the general ideas.
Thanks, Dr. Meenakshi. So would you think that patients who are in your clinic, in your outpatient clinic, in a hospital palliative care setting, is that your context that you're thinking of? Or are you thinking of in home-based palliative care, use of mirtazapine? So that is what I mean in the context. Your population is clear, but I also want to know about the setting, because is it the hospital? Is it the community? Is it the ICU? Is it the inpatient ward? Because we need to think about the setting, because in the last lecture you would have seen the whole thing about the PICO statement, population, intervention, comparator, outcome, etc. So apart from the population, the setting is also important. Dr. Meenakshi, thank you. You've already said the aims very well, that you want to know when the onset of improvement in appetite happens. So that is your aim. Anybody else wants to? So you have to think about the topic we've got. I'm going to focus on just this so that I can get my head around it. So mirtazapine in palliative care. Context is about in the hospital, clinic, palliative care clinic. The aim is whether mirtazapine improves appetite or not, and one is that when is mirtazapine improving the appetite. So our nature of the question is, it's what, how, why. We have does it, yes or no, so what, and when, which I do not have. I do not have these questions here, but those can also be, as Dr. Meenakshi said. And what will the relationship be? The relationship with thinking that mirtazapine will improve appetite. A few more relationships could be, what dose of mirtazapine will improve the appetite? When will it improve the appetite? Is one dose, is a higher dose better than the lower dose? Would that be right, Dr. Meenakshi?
Yes, ma'am.
Yeah, right. Okay. So is that clear to people? So whatever we think about the topic, we need to think about the context. We need to think about the aim. We need to think about the nature of the relationship and what will be the relationship. How will it do that? So for all your topics, whichever that you had started with, and some of them that I know, it's time for you to do this exercise. This will take a little time, so I'll give you 3 minutes for that. So remember, it is topic, context, aim, nature, and relationship. So if you want to take your time and then tell me, and I will write it down. Do you want this on your screen to help you? One more minute. So let's start with let's do that. Whoever wants to share, preferably not the ones we have already done. Somebody else. Dr. Pooja, Dr. Khushbu. So topic. Right. Last, it's so much better if I do with what you tell me rather than me doing on something that I think of, because that's not the idea at all. So please help me.
Pooja, Khushbu, why are you not speaking? Other palliative medicine first year residents, why are you not speaking? Are you not listening? Any first year palliative medicine residents besides TMH?
It's, remember we said we will do this together. So it really is no pressure. We are all here to learn. You know, Teachers' Day will not be Teachers' Day without students. And what you are today, we are learning from you every day. So why not take this chance? Anyway, we have 10 minutes, right? So who will save us? Anybody who wants to do this? Somebody who has not shared? Or shall I do it on my own?
Ma'am, ma'am, can I join?
Quran.
Yeah, ma'am, topic is place of dying. Preferred
So-
place of dying.
Okay, let me just do this one by one, Quran. Thank you. Place of death. So, place of death, dying. Thank you. That is the topic. Right. Next would be
Next would be, ma'am,
context. The
context,
context.
yeah, yeah.
Context. Right. Okay. So you would. What are you thinking? Sorry.
Ma'am, context would be in palliative patients with head neck cancer.
Okay. And generally. So where to context, where will you study them? Will you ask them when you are in the community, or will you ask them when you are coming to hospital or on home care? So we will need to get that context. Great. Thank you, Burhan. Next
ma'am.
would be your aim.
Yes, ma'am.
So what is your aim?
Ma'am, my aim is to objectively evaluate. Okay, objectively evaluate. I wanted to make it, as you said, more quantitatively to assess,
Right.
because the existing literature on this is more qualitative. Okay, like surveys and stuff like that.
So
So
you, sorry, Burhan. So you want to know the place of death.
yes,
So you want to objectively, by an objective measure, you want to know patient's preferred place of death.
death.
Would that be right?
Yes, ma'am.
Okay.
Patients preferred place of death, but ma'am, as well as to try and take all the all the stakeholders in mind, not just not just asking the patient or the
Yeah.
relative.
So you mean the caregivers and things
Yes, the
like
caregivers,
that. Okay.
the hospital, the
Okay.
system, the administration, everything.
All right. So other stakeholders. So our next thing would be to do the nature. So nature meaning you are basically, you want to know what, right? what is their preferred place of death. So in hospital, okay, what we are that which I said, you know, the nature, topic, context, aim, nature. So here I am thinking it is what that you want to know, and what do you think is the relationship going to be? So if we know something, it would be probably be home is what we do it. But you've said that the other qualitative studies are there, which may be home hospice, or you may think that there may be differences. Some would be home, some would be hospice, some would be hospital, and you would want to know the differences as to why. I'm just going in like that, Burhan. It is not clear, but this is the template that we use, and we go on to the next one. Is that okay, Burhan?
Yes, ma'am. Yes, ma'am.
Okay, great. Is with Burhan's example, any topic, any doubts for anybody else? Right? So then what do we need to do? We need to go back to the beginning. When we are writing the research question, it is also more or less again an iterative process, because we have to go back and forth till we get everything clear. So remember I said that is the question right for you? Will the question hold my interest? Burhan, yes or no?
Yes.
Yes.
Ma'am. Yes.
And can I manage any potential biases, subjectivities I may have? What do I mean by that? Is that if I think that, oh, I'm going to think that it is going to be home, that previous literature has said home, I am going to close my mind and I am going to be more open to bias, which I don't want to do. So even if it is of interest to me, I need to make sure that I am not biased about one particular outcome or the other, because I'm here to explore that. Is the question right for the field? I'll just take Burhan's example, and I think yes, because the findings will be considered significant. Is the cost likely to be within my budget? I don't know. We haven't explored that yet, but hopefully yes, because if it is not, then we cannot proceed further. And will there be potential ethical problems? Can they be avoided or circumvented? We have to see whether yes or no. So these are some questions to ask. So is the question right for you? Remember, we did it right at the beginning. Is it right for you? Is it right for the field? Is the question well articulated? So we need to work on that. Are the terms well defined? Are there any unchecked assumptions? So are the terms well defined? In Burhan's example, what do we have? We have palliative care. We have preferred place of death and dying. And we have head neck cancer patients. We have stakeholders, we've said, but we have to outline what the stakeholders are. So whatever are the terms in the research question, we need to define them very well. The next thing is the question doable? So what all things we need to look at it? We need to see that can we collect the information in whatever way that we are planning to. Do I have the skills and expertise to do this? If not, can we get the skills? Can we develop the skills? Can it all be done within time constraints? So I am finishing my MD in 3 years. I need to do a dissertation in that 3 years. So it is not going to be feasible if I do something for the next 5 years, if that's going to be my research question for my dissertation. So we need to have the time constraints. And also, what is my budget? It's very important. We don't talk about that, but it's costs are going to be, if costs are likely to exceed my budget, that's not going to be feasible. Are there any potential ethical problems? And of course, if I'm doing something under my supervisor, does my supervisor or mentor think that I am right? And do experts in the field think my question is right? Because we are always going to we said at the beginning that is the question right for the field. So this is a template that we can do. This is what I have one more because some of you are not not really sharing as much as I was hoping to. So I had kept this as an example. So how do caregivers perceive end of life care received by their patients in a hospice in a low resource setting? So what is my topic here? Anybody? I'm giving you this. You just have to fill in the blanks. My topic here is end of life care. Thank you, Varun. Okay. Is there a subtopic? So it's actually perception, caregivers perception of end of life care. That will be my subtopic, is caregivers perception of end of life care. And what is my context here? That's pretty straightforward here. Is it's in a hospice in a low resource setting. So I want to know what is the end of life care, caregivers perception of that end of life care received by their patients in hospice in a low resource setting. What is my aim? Exactly that I want to know caregivers perception of end of life care in this setting. What is my nature? It is I want to know what. I could also want to know how do they perceive, why do they perceive the way, but I want to know what is their perception. So my nature is what, and my relationship is actually I don't know enough at this stage, to be honest, and I want to know more. I have my high income countries setting, and there is good perception that there is good end of life care received in high income countries. And if I want to take a guess, and I would say that yes, it will be similar, that caregivers perception of end of life care received, caregivers will think that there is good end of life care received by their patients in my setting. So that would be my hypothesis and a conjecture and my relationship. Is that clear? So I don't think we have time for one more. We have done two, but for the research question, when we write the research question, those five sort of headings that we have, and this is the checklist. Is the question right? Is the question right for me? Right for the field? Is it written well? Are the terms defined? Is it doable? And does it get the tick of approval from whoever that I need approval from? So in the last 2 minutes, do you want to check with your question, whatever you've written and working on, and we'll be keeping this paper. So a minute for that you can write down your notes to yourself for what is to be done. Okay, all right. I hope you have done your question and you have checked your question. And this is some acronym that people have written, that it's FINERMAPS. So in a nutshell, whatever I have said in the beginning and through this talk, is that something that is feasible for the research question, how to develop it. It's feasible, it's interesting, something novel, it is ethical, relevant, is it manageable, is it appropriate, has it got the potential and publishing, and is it done in a systematic way. So this is something that is a sort of acronym for doing a proper research question. You tick that. The chart and this thing more or less says the same thing. And thank you for listening. I will stop screen sharing now.
Thank you, Jayita. Thank you. Such a wonderful presentation, Jayita. unfortunately, people have not participated actively. I think MDs, they must have not even, I think they have not utilized, according to me, it's a beautiful lecture. So thank you very much. And as usual, Jayita, for me, it was a very, very informative. And the way you are teaching, I think there is always a learning from that. So
Thank you so
we-
much. If there is any question now and people feel comfortable enough to share, please ask. We still have 2-3 minutes at least.
So you can see the chat box, Sujata. I think there are no questions.
Okay. Thank you very
Okay.
much for joining. Miss, thank you for all the good appreciation on the chat box, Meenakshi and you, ma'am. That's been always a pleasure to do a talk, and I really hoped that people will take part, but that's okay. And we all feel shy, but maybe next time. Thank you very much.
Thank you, Jayita.
Happy Teachers' Day.
Thank you, Jayita. Thank you, everyone. We will see you next week. Thank
You,
you
ma'am.
very much. Thanks a lot. Bye.